Hello, I'm Chris and today I'm going to be performing the skill of the medical assessment. We'd start the skill off by applying proper PPE, which would be a pair of gloves, unless anything indicates that we might need more protection. So we would do the scene size up, which would be determining if the scene is safe. The scene would be safe. Determining the nature of illness or the mechanism of injury. So the nature of the illness, it looks like signs and symptoms of heat exhaustion. Next, we would determine the number of patients, which would be one. We would consider EMS assistance if necessary. In this case, we do not need EMS assistance. Next, we would consider C-spine precautions. In this case, we would not need C-spine precautions unless it's indicated later. So we would start off by doing the primary assessment, which would be start off with the general impression. So we would say that this is a male patient in his late 20s, about 150 pounds, lying supine with pale, clammy skin. Looks like he's having difficulty breathing. So after that, we would determine his level of consciousness by asking him questions like, can you tell me your name? Do you know where you are? Do you know what time or what day it is? And do you know what happened? If they are able to answer all these questions, then they are alert. So next we would assess the airway. The patient was able to talk to me and communicate, so we would assume that his airway is open. For breathing, the patient is having trouble breathing. His breathing is rapid and shallow, so we would administer oxygen. Next we would assess the circulation. His skin is pale and clammy, and his pulse is weak. So then we would feel his temperature. His skin is cool. There is no major bleeding. So then next we would identify the patient's priority. So the patient is not a high priority patient, but we should still consider the fact that he may become one. Next we would do the history taking, starting off with the signs and symptoms. So we would ask him when did this happen, the onset, and what was he doing before this occurred. So he would tell me that he was running when he started feeling this way. Next would be provocation and palliation. What makes it worse, what makes it better. So he would tell me that what makes it better is lying down, and what makes it worse is getting up or doing any moving. So next we would determine the quality of his breathing. We'd ask him questions like, how does it feel when you breathe? The patient's would say something like he's having real trouble breathing, that it feels like there's something on his chest maybe. The severity, so we'd ask him a question like on a scale of 1 to 10, 1 being the worst and 10, or 1 being the worst, 1 being the best and 10 being the worst. How bad is his, or how much trouble is he having breathing? Patient would say 5. And then we would ask the patient how long has he been like this. The patient would say that he was like this for 10 minutes. So next we would ask him if he had any allergies. The patient would tell us he has no allergies to anything, no latex, no food, no medications. Next we would ask him if he has any medications. So if you have any medications, the patient would say no. We would clarify like no over the counter, no prescribed, no herbal substances, no recreational substances. The patient would say no. Next we would ask him if he has any pertinent medical or surgical history. So, sir, do you have any recent or important medical history or anything? Patient says no to both. Would ask him what his last oral intake was. The patient would say that he had a salad. And then actually would ask him what led up to it. And as he said before, the patient was running for a long time, and then he started feeling bad. So next we would take vital signs, starting with the blood pressure. So we would take the patient's blood pressure. So we take the patient's blood pressure. His blood pressure would be 124/82. Next we would check the patient's pulse. So we take his pulse. His pulse feels weak and slightly elevated, going at 62 beats per minute. Next, we would check the patient's breathing as we are taking their pulse. We would say that the patient's breathing is 25. All right. So the interventions that we performed is that we administered oxygen to the patient, and he was laid down. And what else we would do is we would give the patient water if they're able to tolerate, unless they become nauseous or begin to vomit. Then you would not do that, and you would take precautions like putting them on their left side. So we would reassess the patient. So we would reassess the patient to determine if the oxygen has helped his condition. We would determine if the water helped him, and see if his skin has changed in color, if his pulse has changed, or if his breathing has gotten better. And we would give an oral report to the arriving EMS unit. So we would say we have a male patient in his late 20s, 150 pounds, who was seemed to have had heat exhaustion. The patient rated his breathing at a 5 and had a rapid rate of breathing and a weak pulse. Oxygen administration was applied, and we were traveling. We are transporting him now. Estimated time of arrival in 10 minutes. And that would be all.